In 1990, the last time we had a financial crisis that led into a recession that had to do with real estate. So therefore, it's an analogous position, although I think 1932 is really the only analog. But using this one period where market didn't all plummet, biotech stocks were the single best performing group. Now, we just passed the Rescue in America plan, but we're going to be in a severe recession or a Great Depression, courtesy of a weak economic environment both here and globally. And that has nothing just to do with mortgages. It can't just be fixed by legislation. It has everything to do with Brazil, Russia, India, China, with credit. And remember, what we're facing is either a Great Depression or a severe recession. And either one of those is very difficult to own stocks. But biotech shined with a similar set of circumstances. Now, why else do we like biotech? Because it looks increasingly likely that the Bolsheviks will storm the Winter Palace. Did it again. I mean, we'll have a Democrat in the White House next year. And almost inevitable that the Dems will have more seats in Congress than they do now. And the Democrats, they love biotech. In 1990, Amgen was the best of the biotechs. This time around, I think it's a possibility that there's a bunch of good ones, but maybe it's Genzyme, a biotech player that focuses on developing what are called orphan drugs that treat rare diseases and thus get extra special exclusivity treatment from the federal government and the EU. Democrats, by the way, love orphan drugs. Stock hasn't done much since I last recommended it on August 12th at $79. It's down 3.8%, but given the fact that there's been just a wholesale carnage, that ain't so bad. I think that things could change. Genzyme has 3 drugs coming up for FDA approval between now and the end of the year. Approvals that together could be worth between 33 to 36 cents to full-year earnings per 2009. Given the current environment, speculating on Genzyme's drug approvals is the only kind of speculation I am now allowing. Everything else is too dangerous. Genzyme's safe. That's why I'm bringing on Henry Cramer, Genzyme's chairman and CEO, to talk about company's prospects. Henry Cramer, welcome to Mad Money.
It's good to be here.
Yeah, I last was with you in it was probably like 1990 when I came up to see you when you had that spin-off of Genzyme. Okay, can you explain to viewers why everybody thinks of drug companies and biotech all as if they have the same strategies. Can you explain to viewers why you've got a unique mosaic going that makes it so you're actually a lower risk, high growth company?
Now, we have focused for many years now on very rare, very severe diseases. And we've been so fortunate that over the years we came up with real solutions. And these products are just incredibly strong when they get to the market because these patients have nothing. And you start to treat them. They really stay on these treatments, and they stay on these treatments for life. And that builds and builds and builds, and that has been a picture that has repeated itself a number of different times. We're still in the middle of a number of very, very exciting new product introductions at this time, and we expect that this kind of model, where you have a big step function in terms of clinical benefit for patients that have nothing else to treat them, really is very, very beneficial, very stable.
These are very powerful drugs for people who have nothing else to help them. But will their insurance companies pay for these drug treatments?
Now, insurance companies are very concerned about paying for something that doesn't work. They're not so concerned when you have something that really works. And that's the difference here. That's why we get support for these kinds of drugs, these kinds of relatively expensive therapies across the globe. We get very good support in very conservative countries like the Netherlands, where I used to come from, and like England, like Canada, like Australia, because these drugs really make a very big step function difference for these patients.
All right, the FDA is approving fewer and fewer drugs each year. They're giving drug companies a lot tougher time. Given orphan status of your drugs, have you experienced increased hurdles for approval?
The FDA is a very big hurdle, and it has become more complex. It has become more complex for all drugs, including these drugs. So we test many patients, many years, very large percentage of these very rare populations, and indeed then we get approval. It is more complex today than it used to be 20 years ago, but that's just the place where we are.
Now, you have some, I know that you're sticking with your orphan drug and your, I guess I would call it as a layman, a niche strategy, but you've got some late-stage pipeline drugs that seem actually a little bit bigger. I'm going to mispronounce this because I'm just reading, but mipomersen, I mean, isn't this a bigger opportunity than you usually have?
Now, mipomersen is a cholesterol-lowering drug for those patients that cannot be treated with statins and other drugs. And that also is a relatively rare but much larger population than the population for these ultra-orphan drugs. And we have Campaz for MS, which is, of course, about 1 million patients, and we have Renvela Renagel for end-stage renal disease patients. That's about 1 million patients. So we are diversifying, but we're staying with these very well defined patient populations that have real, very well defined clinical problems, and we go for step function treatments. And so the principle is the same, just the populations are larger now.
I wanted to ask you about the MS drug. You have phase 3 studies underway. It's a $6 billion market. Can you give me a feel for whether this is a horrible disease, why yours is so different from everybody else's?
Now, we have a once-a-year treatment, rather than once a year, rather than every week or every month. And we have a very, very good efficacy profile, at least at the current phase 2 level. We have to prove that. We have to prove the safety and the efficacy. That work is ongoing.
Okay, when you develop therapies for these rare diseases with an unmet need, how does a doctor find out about it?
Now, it's mostly clinical communication, because indeed rare diseases are not followed by many physicians. So you have few specialists, and then you bring the community on board, and that often takes many years. And that's why these markets continue to build over time. You don't have like a big step function change shortly after introduction.
Well, Henry Cramer, you've been a moneymaker for years and years and years. I'm thrilled to have you on Mad Money. I know you were going to go to our Michigan, we didn't get it to work out, but I'm so glad to have you. Thank you for all you've done for shareholders over many, many years.
Thanks, Jim.
Very appreciate it. Okay. Henry Cramer, Chairman, President, and CEO of Genzyme. You want to speculate like a pro. You speculate with fabulous companies that have been around that have really exciting drugs in the pipeline. Genzyme fits that bill. After the break, I'll try to make you more money.